Hello everyone. This week we're looking at the topic of access to local food, and we're pleased to again have with us Dr. Charles Chuck Gardner, and who's the Medical Officer of Health for the Simcoe Muskoka District Health Unit, and again does lots of interesting things in his capacity as the Medical Officer of Health. And I think we can all appreciate how important nutrition is as part of that, how important local food might be. So as we look at this topic, what have you witnessed in the evolution of our thinking about local food over your career?
It's gone from being something that was invisible, didn't always appear on the agenda for people, and in more recent years it's become something very topical. I think it's still a challenge to achieve. I know that in Simcoe County I've been part of the development of a charter that the counties of Simcoe organized, developed. And it has certainly the intention of promoting local food and helping to make access to local food a reality as a priority. Muskoka also has a charter, and there too the importance of local food is included. So there's the intention, and people see the value of it, but there can be real structural challenges to actually achieving it.
Just for clarification, what is a charter?
So food charter is essentially a statement of intention about what an area or a district wants to achieve with regards to food, about access to food, about the production of food, about the availability of food, ability to afford food, about the nutritiousness of food, right? The economic viability of it all, right? So both Muskoka and Simcoe have food charters with that kind of content.
How important is local food to our health? I mean, and I know you can look at that from different points of view, all the way from what are the carbon emission effects of local food versus bringing food from California.
Yes.
But is there a connection to our personal health, or is it just fresh food that's the more important thing, and that there are other environmental and economic benefits from sourcing it locally?
Most tangibly, it's fresh produce that's important for our health, right? A diet in which you have a sufficient amount of vegetables, fruit, low sodium, fresh produce, right? And food that is safe, it's produced in a way that you don't end up with food poisoning, bacterial food poisoning, right? And the source of the food, I think, is important from the point of view of environmental sustainability and economic viability of an area and affordability of food. So there's certainly many people, in the range of 10% of our population or more, who have trouble affording food, right? And the availability of food that is that they can afford, and the adequacy of their income, I think, is a big part of this, is an important determinant of their health. Such people often have diets that are shifted much more to heavily processed, high carbohydrate, high sodium, low nutritional value food, right?
That whole economic perspective is interesting, again, because it speaks to that sustainability diagram of the economic, the environmental, and the social. And we would attach value to local food, we would attach value to fresh food, which also speaks to another element in terms of planning for other grocery stores in communities or in neighborhoods and so on. And I'm aware of a little village of 1,100 people which lost their grocery store. And what do they do? And that's not just about local food, but access to quality food of any kind. And it just reminds me of the fact that, and I think you said 10% of the population has difficulty affording fresh food, which is an important thing which helps to tie some of this together as well. So what do you think are the opportunities for farmers, community groups, and citizens in addressing local food?
So the charter that was done in Simcoe County, the one that was done in Muskoka as well, they certainly identified that there need to be opportunities created, right, to sustain the production of food here, to sustain economically for food producers, to sustain people's access to healthy, nutritious foods here, to enable people to actually produce their own food to some degree. So community gardens that would enable people within cities to do some of their own food production as well. So with that charter in Simcoe County, the municipality has sought partnerships with the farming community, with local colleges around training for farming practices, has sought to raise profile for food production and people's awareness of local food, and people's awareness of where they can go to access local food, promoting farmers markets as a way of doing that, or promoting local farms that are used for agritourism. So pick your own locations. Those have been sort of some of the things they've sought to do, framed around that charter, identifying these are priorities now, how can we act on these things, right? And so this is meant to go on over a number of years. They did speak to the potential value of developing a food terminal for Simcoe County. Now that is, I think, yet to be manifest. But the idea is still there. That is something I understand has been very beneficial to the City of Toronto to have a food terminal. It's a means by which food is brought in, wholesaled, and then distributed out to markets to help ensure that the city is well supplied with fresh produce, and thus improve the nutritional status of Torontonians and neighborhoods here in Toronto. And the thinking was, if we could develop that here, it would be a terminal that would enable food from all over Simcoe County to be brought together in one place and then distributed out to local markets, so that they would indeed have local food. It would facilitate the provision of local food. I attended a conference organized around this charter in which they deliberately serviced the day with local food, and in order to achieve that without that terminal, they had to transport themselves all over Simcoe County to make the procurements required to do it. It wasn't like readily accessible, right? It was far easier to buy produce that was at local grocery stores. It was from everywhere and not necessarily local at all.
I'll put a little plug in for the University of Guelph, because it's one of the things that food services there does really well in terms of sourcing local product, which I think is really quite fantastic. And also to mention, there's the Elmira Produce Auction, which is kind of interesting. I don't know if you've heard of it, but at the Elmira Produce Auction, this is a way by which the Mennonite and Amish community come together, and you know, small producers who don't have enough production to get into the big markets come together and pool their produce, and then they're able to attract the buyers to put it out into the broader food system, which I think is a pretty cool initiative on their part. What do you think are some examples of success that you can share? You mentioned a couple already, I think, but any other examples of success that you think are worth noting?
I'm quite happy with the development of community gardens. There have been some that have been developed in Barrie and Wasaga Beach, others planned elsewhere, and to me that has enabled people to have a direct hand, literally, in the production of their food, to be able to make very affordable food for themselves, fresh produce, and is also a community builder. They've been shown to help people develop their social networks. That goes back to the social determinants of health. Having strong relationships in your community is important to your health, and it's meant to enable vulnerable populations, lower income individuals, to meet a need that is otherwise very hard for them to meet, as I mentioned before. The diets of people low income tend not to be healthy, tend not to contain enough fresh produce. So those are a couple of successes, I would say.
Are those community gardens on public land, like parkland, that have been converted over, which is again very core to planning initiatives and direction?
Community parks that the municipality has set aside for that purpose.
Okay. How do you think planning and public health can work together in this topic area?
Well, certainly, once again, we promote healthy nutrition, and that this is essential to health. And it can be a challenge in the modern era with a diet that is very processed for the most part, right? And we find ourselves in a situation where we're promoting this kind of thing and people don't necessarily have the ability to do it, right? We need a food environment that enables them to do the kinds of things we would advise. And that speaks to affordability to some degree. So there's certainly a large number of people who simply don't have enough money. And there you end up onto the topic of supports and financial supports for low-income populations. It's a policy question for the province, for the federal government. But initiatives such as community gardens can assist with that, at least to some degree.
There's a whole range of probably educational programming to connect with that. I know some really interesting work done at the University of Buffalo with Samina Raja in terms of even the processing that can happen in a community context to take advantage of those local resources that are there, because we do. It was interesting. I was in Tokyo earlier this year, and all of there's as much agricultural land within the city of Tokyo as there is parkland. Think about it, as much and greenhouses and production right beside apartment buildings. It's quite remarkable, actually.
Yeah, they have the potential, you know, for terrace gardens and such, even in urban environments. And researchers, you go back to the topic of the built environment, they speak of food deserts and food swamps, you know, urban environments in which the only food to be had, if there's any, is fast food, and that goes right back to zoning and to incentives that municipalities can create for the availability of fresh produce within the community, whether it's community gardens or whether it's farmers markets or whether it's grocery stores. It's also important to know that some research has shown that paradoxically, rural populations can actually suffer from poor nutritional status when it comes to access to fresh produce. Yeah, it runs counter to what you would think, right? The very areas that produce fresh produce don't necessarily make it readily available to their own local people. So rural populations in small towns, what are the issues with regards to access to healthy, nutritious foods, and how can we help with that? Even though they do produce these foods, how do they make it available to their citizens? And I think it would go back to the same sorts of solutions that we'd be looking for in neighborhoods of larger communities. And that would be ensuring that their grocery store remains open if they have one. You cited an example of one in Loss. So you know, what can you do with the municipality about that, advocating that they have policies that would facilitate grocery stores remaining in place, farmers markets being in place and thriving, and community gardens. And affordability itself, if you have low income and poverty as an issue, what kind of advocacy can we be doing together with municipalities to the province about supports for low-income people and enabling them to have more income at their disposal to be able to afford food? What kind of economic development can be done so that they have a better job that can enable them to buy more food? What in the way of local tourism could be developed that could help to enable that? To what degree can that actually be coupled with agriculture? So agritourism, what can be leveraged creatively? And then what can we do as a health unit to assist with that? Certainly we can join in the consultations that happen with charter development, so we can bring to the table our own evidence about nutrition and its importance. We can bring to the table our research about the affordability of food in our communities. We do an assessment each year about food affordability. We systematically look at the price of food in retailers and put out a report each year, or report on the affordability of food compared with previous years. And that kind of thing can be helpful, I think, for planning, and it can be helpful for advocating policies that help to address challenges like that.
You can see linkages into social services and things of that nature as well, in that broader municipal environment, which is really important.
Yes.
And of course, farmers markets. I think we've alluded to that at various points, but how they've proliferated in many ways over time, and how much more opportunity there is for consumers to find products at farmers market, and the economic opportunities there for farmers, which are part of that as well.
Yeah, and they can certainly help leverage other things, right?
Yeah.
So if you're choosing to place farmers markets in locations where people can walk to, then it's easier for them to get that physical activity as they go, have that social experience. Buying local produce that supports local producers. So there's a lot of virtues that can come together with enabling farmers markets and placing them strategically in communities, including in smaller communities.
I find it interesting, the farmers market in the town of Godrich, which is sort of in an octagon, and the park is in the center, and the farmers market is around the perimeter, and people will go one direction and then go the other direction, so they run into people. It's a very cool social opportunity. Anything else you'd like to offer concerning this topic?
It's one of those absolute fundamentals, and it's certainly important to communities such as Simcoe Muskoka that are largely rural. And it's also vitally important to large urban centers as well. We all have that common need for good nutrition, and it links us to rural locations, even if we do have some urban local production of food. We are all fundamentally linked to the land by the need for our local produce.
Well, once again, I want to thank Dr. Gardner for his contributions and his expertise. And I have one final follow-up question for him as well. And that would be, do you have any advice for the students? We're probably towards the end of the semester, I think, by the time we get to this topic. And any advice for the students, whether they be planning or Masters in Public Health students, in terms of embracing the notion of healthy rural and small town communities, or career directions, anything along that topic area that you'd like to comment on?
I believe that we all need to spend some time in our educational experience linked in some way with a more rural location. So if they have the opportunity to do a practicum in a smaller community or smaller health unit or a smaller municipality, that would help them to get more of a tangible sense of the realities and the challenges of those communities. So, you know, the research tends to focus on the bigger communities, and I think it's because they're bigger communities with bigger populations and perhaps therefore easier to get grants and study. To overcome that challenge, perhaps we need to spend some time in smaller communities.
Sounds like great advice. Well, thank you again for your contribution to this session and all of the other sessions that we've had the pleasure to discuss with you. I know that you play a real leadership role in the province in terms of healthy communities and built environment from the public health perspective, and I know it's been a real positive influence to the planning profession, so thank you for that as well.
Thank you. I've been delighted being part of this.
Thank you.